What's up, everyone? This is episode 2 of my live Q&A, completely unedited and raw. On this Q&A, I just had 2 questions, so this will be a shorter video. The first question was about TMJD flare-up. So if you don't know what that is, it is essentially a dysfunction of your TMJ joint right here. Either side, they didn't specify what side it was on. However, this person was also noting inflammation in the ear and dizziness. So all of this can play a role. So if you go see someone for this, they need to obviously do a very thorough workup, because we need to determine, is the inflammation and dizziness coming from dysfunction of the TMJ joint, or do you have something going on in the inner ear? So vertigo can actually be caused by several different things, but for the sake of this video, the 2 main ones I would be looking at as a chiropractor after I rule out something bad would be inner ear infection or swelling or fluid in the inner ear, which is causing the vertigo or dizziness, or dysfunction within the neck can also cause dizziness. If there's dysfunction within the neck and the neck is turned in certain positions, it can cause it as well. But as far as the TMJD goes, and I added D at the end because D stands for disorder. So TMJ is not a condition. TMJ is the joint itself, the name of the joint. When you add the D at the end, that is a condition or a diagnosis. So if someone says, I have TMJ, well, everyone has TMJ because that's a joint. But if you have TMJD, that means you have a disorder going on with the joint. So just a little housekeeping there. But if you have it severe enough and there is actually inflammation within the joint and something more advanced going on there, yeah, of course, it's right here near the ear. So within deeper than the skin and everything, you can have a lot of inflammation in this region that impacts both the ear, the throat, and the jaw as well. So that is definitely a possibility. But some things you can do for the TMJ, the joint itself, is just some simple self-mobilization of the joint. You can work on what we call the resting jaw position. So a lot of people clench and bite down and put a lot of stress in their jaw without even realizing it. So the resting jaw position is simply, you're going to put your lips together, but your teeth do not touch. And when you do that, you're going to put the back of your tongue right behind the front teeth. And it's almost like you're saying the letter N. So say the letter N, hold that, but close your lips. In. That's the resting jaw position. It keeps everything relaxed. It keeps your jaw from clenching, and it helps take stress off there. Also, just some simple things. You can put a little lotion on your jaws, right on that meaty part. Take 2 fingers, close your mouth, and traction up on that muscle, up towards the ceiling. Hold it. Once you get that tension in that muscle, hold it, and then slowly open your jaw, letting your fingers glide and stretch that muscle out. And you can do that over and over again to get some relief and some stress out of the jaw. So question number 2 was about Cauda Equina syndrome. So Cauda Equina syndrome is an emergency. So essentially, for the sake of this video, the lower part of your spinal cord becomes impinged, and it can become impinged in several different ways. It could be a tumor, a severe disc herniation, narrowing of the actual canal that the cord goes through. There's a lot of different ways, but it is an emergency because if it's not fixed soon enough, it can severely impact just control of your legs, control of your bowel and bladder. So a lot of times people will get severe pain between the legs in the private area, the inner thighs. They'll lose the ability to completely void and get everything out when they use the bathroom, or they may lose complete control of the bowel and bladder. It's an emergency to relieve that pressure and fix the issue off of the spinal cord. So with that being said, if there is long-term impacts from that, as far as like paralysis or dribbling or issues initiating going to the bathroom, that's not something really I deal with. I don't deal with that. That's a little more advanced, that needs to be discussed with the neurosurgeon who did the surgery to help relieve them. And if they say there's nothing to do, you can always contact or have your primary doctor reach out to different hospitals and see if they have OT or PT specialists that deal with this kind of neuro rehab and things like that. But that's pretty severe, and that's pretty advanced progressions of Cauda Equina, and it sounds like it was either like a car accident, or it just happened so fast that the impingement on the spinal cord was there too long to completely get back to 100% of what the patient was before it happened. So that is a very serious situation. But I tell everyone, in every medical profession, there's different experts and specialties and things like that. So just because maybe one area of physical therapy failed you, or a certain group failed you, or chiropractors or medical doctors or surgeons, doesn't mean that someone else in the United States or around the world with the same title can't help you. Because everyone has their own, cup of tea, their own specialty. So there are people that, I'm a sports chiropractor, and then there's other chiropractors that specialize in other things that I'm not well versed in. But I may be more well versed in what I do compared to them, but we're both chiropractors. So just because someone has a specific title and wasn't able to help you doesn't mean to give up. If you search deep enough or ask the right people to connect you with people that may be able to help, then it's always worth the conversation. So I hope that helped answer some of your guys' questions. Please continue to support my YouTube channel, my Instagram, @SI Athlete Chiropractor. And continue to engage in the live Q&As, because again, I'm doing this for you guys and you supporting me, so I don't care to put the time and effort in, but we have to have engagement. It takes a lot of time and effort to do this stuff. So thanks a lot for engaging and your support.